Margaret, you can go on with your presentation.
Opinion of nurses on what
All the
related
best.
stress
All the
and
best.
strategies adopted to cope with it at Wesley Guild Hospital, Ilesa. General tips. Stress has become a major recognized term over the past decade, and it is a major cause of concern for nurses at work. Stress could be defined simply as the rate of wear and tear on the body systems caused by life. Since 2005. Also, the Health and Safety Executive (HSE) defines stress as the adverse reaction people have to excessive pressure, other types of demand placed on them. It is important to understand the impact of nursing staff because the psychological and mental harm caused by stress can adversely affect the delivery of patient care. A survey of the literature on nurses reveals that although a great deal of research has been carried out related to stress and coping in nurses internationally, little has been written about nurses in Nigeria, given that the international hospital settings and provision of health services are different to those in Nigeria. It will not be appropriate to use the results of previous international studies to explain stress and coping among Nigerian nurses. Problems. Stress is recognized as an inherent feature of the work life of nurses, and growing evidence suggests that it may be increasing in severity. It was found that job stress impacts not only on nurses' health, but also their abilities to cope with job demands. This will seriously impair the provision of quality care and the efficacy of health service delivery. This investigation is aimed to identify causes and frequency of stress, coping strategies used, and support system among registered nurses. Method. Data from this study was analyzed using the statistical package for social sciences. The first level of analysis involved the use of one variable, such as the frequency and percentage distribution, as well as graphical illustration of responses. The second level of analysis refers to analysis involving two variables, such as those aimed at establishing relationships between variables. The literature was reviewed to explore viewpoints in the field of study. The aim of the study seeks to extend previous international nursing stress studies by measuring a wide variety of coping strategies that might be used by Nigerian nurses in dealing with their work stress. Both conceptual and research literature was used. Sources of information were books, journals, theses, dissertation, and online journals. This study is based on health promotion model of Nola Penda. She developed this model through her research, presentations, and writing. Central to the health promotion model is the social learning theory of Albert Bandura, which postulated the importance of cognitive process in the changing of behavior. Social learning theory, now titled social cognitive theory, includes the following: self-beliefs, self-attribution, self-evaluation, and self-efficacy. Self-efficacy is a central construct of the health promotion model. The following are the factors of health promotion model that expands to encompass behaviors for enhancing health. Prior behavior and inherited and acquired characteristics influence beliefs, affect, and enactment of health promotion behavior. Persons commit to engaging in behaviors from which they anticipate personality valued benefits. Perceived competence or self-efficacy to execute a given behavior increases the likelihood of commitment of action and actual performance of behavior. Positive affect towards a behavior results in greater perceived self-efficacy, which can in turn result in positive affect. The strategies adopted by nurses in coping with stress at workplace is an important aspect of health promotion model, which enhances effective coping mechanism to life stressors, thus promoting timely medical and health advice and to ascertain the exact effect on individuals' health. Results and discussion. A descriptive correlation survey was used. The aim of the study seeks to extend previous studies by measuring the opinion of nurses on work-related stress and strategies adopted to cope with it at Wesley Guild Hospital, Ilesa. Data from the study was analyzed using SPSS. The first level of analysis involved the use of one variable, such as frequency and percentage distribution, as well as graphical illustration of responses. The second level of analysis refers to analysis involving two variables, such as those aimed at establishing relationships between variables. In the hypothesis testing, the level of significance was less than 0.05, thus the null hypothesis was rejected and concluded that there is a relationship between work experience and coping strategies used by nurses in Wesley Guild Hospital, Ilesa. It can be deduced from the study that the frequency of the reported stressor among registered nurses was high enough to be considered serious. Inadequate staffing was the most frequently reported as the source of stress, and positive appraisal as the major coping strategy. The following recommendations were made based on the findings: employing more registered nurses as a remedy for reducing workload, and nursing aides to reduce non-nursing tasks, provision of support and improving work conditions and counseling services after stressful events, and stress management training by the employer or the agency concerned. Policies that reduce stress from shift work should be developed. This could include reducing the number of hours of the night shifts. References: Jezia KM 2003 Stress and Coping Mechanism, Emergency Department Nurse Manager, and some online journals. Thank you.